This meeting is being recorded.
Judy, go look. Welcome, everybody. We're very excited to have Dr. Albright here with us today. We'll get started in just a moment. Thank you all for coming to our Qualitative and Mixed Methods seminar series here at Accords. If you're not familiar with Accords, we're an interdisciplinary research group here at the University of Colorado on the Anschutz campus. And our education program offers a number of conferences, workshops, and seminars every year to support application of pragmatic and health services research methods. We also have a learning health system seminar series that is wrapping up for the year in about a month, focused on models and methods for embedded research. And we have a really fantastic presentation by Dr. Stefan Bose, who will tell us about the Swiss learning health system, which will be fascinating. And then we also have our last qualitative and mixed methods research seminar next month as well from Alison Jari. We'll be talking about reporting and presenting data from qualitative and mixed method studies. And then if you haven't heard about CopperCon, the Colorado Pragmatic Research and Health Conference is May 23rd, 24th, and 25th. It's our third annual international conference. We hope you all will attend. Our theme this year is disseminating, scaling, and sustaining pragmatic research, and registration is open. If you are a local University of Colorado employee or student, the attendance is free. It's also free for local VA and other people who are members of the Colorado Clinical and Translational Sciences Institute, or the CCTSI. That will be a hybrid conference, both virtual and in-person options available. Next slide, please. So today we have Dr. Karen Albright from our Division of General Internal Medicine, as well as the Denver-Seattle Center of Innovation, talking about rapid qualitative analysis. I'm so excited about this talk. We hear so much about rapid qual. How do we actually do this in a way that retains rigor and impact? I'll tell you a little bit more about Dr. Albright, and then I'll turn it over to her. Dr. Albright is a sociologist and health services researcher, a longtime friend of Accords. We're so excited to have you. You've worked with a variety of qualitative and mixed methods over the past 20 years. Her research agenda focuses on health disparities and social determinants of health among socioeconomically disadvantaged populations. As a social scientist, she seeks to understand how organizations and institutions structure, culture, and processes affect dynamics within and across the healthcare system. I'll turn it over to you for your presentation. And we encourage asking questions in the chat. We'll have a facilitated discussion towards the end of the talk.
Great, thank you so much, Bethany. Let me get my slides up here and we will get going. I'm so pleased to be here today. I'm very impressed by the roster of seminars that that Accords has put on. Of course, that's nothing new. I know they've been a very thoughtful for a very long time about educational offerings for folks. But I understand that my talk today is fourth in a series of 5 very thoughtfully planned qualitative and mixed methods seminars. The first being a one about sort of an introduction to mixed methods, a second about study designs and incorporating theory, the third about novel and or asynchronous data collection, then mine with a rapid analytic focus, and then this fifth and final one that Bethany mentioned around data visualization and presenting results. I think that this, really, again, is a very thoughtful presentation, and I'm glad to be a part of it. So as Bethany mentioned, I am going to be focusing today on rapid qualitative analytic techniques. And to be honest, Bethany already covered several of the slides that I had initially prepared by way of introduction. So I'll just say very briefly, or reiterate very briefly, I'm a sociologist by training, which these days, because that discipline hasn't translated very well, I often describe myself as a systems scientist and or someone who's focused on the social determinants of health. But I've essentially been a health services researcher, approaching health services with this social scientific lens for the past 17. I honed this in over a series of postdocs that were designed to facilitate the development of social scientists within the field of health research. My dissertation work had focused on inequality, but outside of the health realm. So I was privileged to learn through the Robert Wood Johnson Scholars in Health Policy program at University of California, Berkeley, and San Francisco, and through an National Institutes of Mental Health postdoctoral fellowship at the Center for Culture and Health at UCLA, joint with Stanford University. And now I have the privilege of being the Associate Director at the Denver-Seattle Center of Innovation, known often by its acronym as COIN, which is a health services research shop funded by the Department of Veterans Affairs, and also located, the Denver portion located at the University of Colorado Anschutz Medical Campus. And also enjoy a faculty appointment as an associate professor in the Division of General Internal Medicine at the University of Colorado School of Medicine. So as Bethany said, my purpose really in my career, my substantive research agenda, is to investigate the perspectives and behaviors of various stakeholders in terms of particular health technologies and experiences. Often it falls under the umbrella of patient experience now, sometimes user-centered design. And that means a variety of stakeholders have populated my qualitative reports and inquiries, everything from healthcare providers and staff to patients or caregivers, and increasingly other system stakeholders like policymakers as well. But my biggest focus is on how marginalized populations interact with the US healthcare system in both the private and public domains. And I'm particularly interested in identifying barriers to care among these populations and testing potential solutions for improving care. I have quite a lot of experience as a qualitative researcher and in mixed method design. I've written 2 articles specifically on methodological considerations. You can see on the slide here, one just published last month. And I've also had a variety of qualitative leadership roles, including many at the University of Colorado campus. I was the lead evaluator for the Center of Excellence in Eliminating Health Disparities a long time ago, and served as the core lead at Accords in what was then called the Qualitative Research Methods Core. I also served as the director for the Qualitative Research Methods Core for the Center of Implementation Science and Prevention, and directed the Qualitative Research Methods Forum, which is an interinstitutional forum for qualitative researchers, primarily across the state of Colorado, but also extending beyond it. And I'm engaged in several current projects that look at qualitative methodologies and needs within the health systems and health sciences world, including one with several collaborators, including at Accords, as well as Northwestern and Mayo Clinic, that focuses on best practices for developing qualitative cores on campuses like ours. But really, the takeaway here is that the thing that kind of unifies my interest in the social scientific exploration of experiences in healthcare and my qualitative and mixed methodological expertise is that I'm interested in impact and in applying qualitative and mixed methods. The operating principle here for me, as well as for others certainly, is what good are data if they're not actually translated or applied? I want to make them useful. I come from an era, I'm dating myself perhaps, but I come from an era of social scientific or at least sociological training where it was relatively discouraged to go beyond observational study. And there was a little bit of a hesitation about applying data. That world has changed, and I hope the training has kept up with it. But certainly in the health sciences world, it seems imperative to me to be able to create and collect data and analyze data, certainly in a way that can be actually useful. And part of that means useful in something closer to real time. I give talks frequently on this subject of application, qualitative or mixed methods, particularly in relation to implementation science, and try to further this mission really of the translation and integration of health and social sciences. And in terms of leadership, I've tried to approach this from a disciplinary perspective in several roles, including over the past couple of years. I served as the president for an organization called the Association for Applied and Clinical Sociology, and most recently as chair of the Sociological Practice and Public Sociology section of the American Sociological Association. I say this not to brag in any way. In fact, I think it exposes me as a glutton for punishment. But I really emphasize it because I'm trying to establish my bona fides here as someone who cares a lot, certainly well beyond lip service, of translating effectively and applying thoughtfully these methodologies and insights, social scientific insights to the field of health sciences. And again, the operating principle here is making things useful. And I think I just want to emphasize here that I think there's an important distinction between data and information. I would consider data to be sort of individual elements that exist in an unprocessed raw state. We are awash in data and ever more so all the time, certainly well beyond textual data. Now we engage in analysis or engagement with visual data and a variety of other sources, ethnographic data. But regardless of what type of data we're dealing with, it's not really useful until it is made into information. And that I would define as processed data that becomes actionable when they're examined in a specific context, translated to relevant audiences. So all of this, again, is sort of a setup to my assertion today, my discussion today with you, that that we need to be thinking through ways to make our research, in this case, qualitative research, more accessible and more time sensitive and more useful ultimately to our various audiences, particularly stakeholders. I think the time for research to be hidden or buried really under academic jargon and behind a paywall is coming to a close, I hope, for most purposes. And I think with this era that we're in of the democratization of information and data, and certainly the innumerable social problems that we are currently facing, it's time to be as thoughtful and closer to real time as we can with our insights and our expertise. So today's talk is going to focus, adhere as closely as possible to the agenda you see on the screen right now. I'm going to start off by talking a little bit about let's say the happy marriage between qualitative methods and implementation science. But I'm also going to highlight some of the challenges, two in particular, to timely, impactful research, and thus the need for analytic innovation. Then I'm going to turn, as a nice setup there, I'm going to tee it right up and talk to you all about what rapid qualitative analysis is and what it might offer to fill this gap that exists in terms of getting our insights from the field to people who can use it. And so that's going to be the bulk of this. I'm going to explain in a step-by-step way how the process might best unfold. And then I'm going to talk as frankly as I can about the opportunities and the constraints that rapid qualitative analysis offers. Like everything, if there are a mix of pros and cons. And also, like almost everything, the key to successfully implementing this is to really understand what bargain you're making and choosing whether it's the right fit for what you want to do. There's no right or wrong here, but I want you to think of rapid qualitative analysis as another tool in the toolbox from which you can consider choosing as you're thinking about what you most want to do with your work. And then I will have hopefully ample time for Q&A, at least 15 minutes at the end of this presentation. But I want to encourage you to please use the chat function throughout the talk. I'm not going to be monitoring that. I can't give the talk and monitor the chat at the same time, of course. But Bethany will be monitoring that chat. And after that, we'll, during the Q&A session, we'll hopefully be able to bring out some of those questions that were posed there. So you can get it out in the chat and not have to hold on to it until the very end. So with that, I'm going to move us forward into this first section of the talk, which, as I mentioned, really focuses on the relationship and the role of qualitative methods within implementation science. So it will not surprise probably most people, listening today, that qualitative methods are really excellent tools to help researchers do a variety of things that are in line with the goals of implementation science. Qualitative methods are excellent in terms of helping to develop interventions or programs. They help to identify effective components within those interventions or programs, or conversely, to help identify components that maybe need some improvement, particularly from the perspectives of particular stakeholders, and suss out why that might be. And qualitative methods are also really well situated to help determine when and how and where and for whom those interventions or programs are most successful. These certainly quantitative methods can achieve some of the same goals, no question, and they can also achieve, in most cases, greater breadth than can qualitative methods. But qualitative methods' ability to go relatively deeper than quantitative methods, even with a relatively smaller n, is a boon for this kind of work. Ultimately, we want to understand why something works or doesn't work, and there's really no better approach than a qualitative method, particularly a text-based, talk-oriented qualitative method like interviews or focus groups, perhaps supplemented with other ethnographic or visual approaches to really understand why or how things are working and for whom. And relatedly, qualitative data are very well situated to help ensure that an intervention will be feasible and useful. There's that emphasis again on actionable. We can use qualitative methods to tell, what the maybe relative advantage over current practices are in terms of feasibility to implement. We can use them to leverage the health system or community strengths, and we can use them to make sure that intervention is contextually appropriate. Again, I'm not going to belabor these points because I imagine that most people on this in this talk are relatively familiar with qualitative methods, and hopefully have already listened to the excellent presentations that have preceded mine and or other offerings by Accords or other places. But the point is that qualitative methods are very well suited to help researchers in implementation science. And for those of you who are uncertain exactly the definition of implementation science that I'm using, I typically think of implementation science as the scientific study of methods used to promote the systematic uptake of research and other evidence-based practices into routine practice. Of course, qualitative methods are relevant for the work of implementation scientists because they can be adapted to a specific implementation setting quite well, and they provide the ability to explore and understand in detail how well different implementation components can work together or not. So all that's well, well and good. But we run into a problem, certainly with qualitative methods broadly, but perhaps especially within the context of implementation science, when we start to grapple with the time intensiveness required for traditional qualitative research methods. And as someone who has, made her bread and butter, quite a lot over the past 17 years through these traditional qualitative research methods, particularly interviews and focus groups, I want to emphasize here that I am in no way slamming traditional qualitative research methods. I am a big proponent of qualitative work broadly, and I, am well aware of the fact that sometimes, good things just take time, and that's just the way it is. But the time intensiveness in traditional qualitative research has become increasingly a problem, or at least is increasingly in tension with health sciences work, because the healthcare delivery needs and the health services research environment, as probably we all know, is a rapidly changing one, with increasing different methodologies emerging, but particularly different technologies and different sets of practices and different constraints on the healthcare system, seemingly evolving, at a exponentially increased pace. The fact that qualitative research methods, and particularly in this case, qualitative analytic methods, have largely remained static over the past 50 to 80 years is something that is a concern and suggests the need for some adaptation wherever possible. Because over the timeline that's typically required to engage in a clinical trial, including time needed to plan and conduct and analyze the results of that trial, often the field has moved, right? Funding priorities might have changed. Certainly healthcare policies might have evolved. And as I already alluded to, newer therapies or newer technologies have been developed. And so what that can sometimes lead to is by the time these research results are disseminated, published, we all know the long arm of the publication journey too. But by the time things are conducted and analyzed and written up and gone through the long process of publication and ultimately disseminated typically through an academic journal article, sometimes those findings are relatively obsolete. And that's a problem, right? There are, at the very least, in some cases, their relevance has been diminished. Certainly not all, but it is happening with increasing frequency because that relatively slow pace of healthcare research, particularly the qualitative angle, has constrained the process. And that sets us up for the need for both more flexible research designs, which would be the focus of other talks other than this one today. But also it sets us up for the need for perhaps more rapid qualitative approaches, which indeed is, as you know, the focus of today's talk. There's also another problem, though, that I want to briefly mention that plagues our modern research environment. And that's this phenomenon that some people have referred to as research waste, which I find very provocative term. Approximately half, by some measures, of completed research is actually never published, and or it has avoidable design flaws, and or it doesn't align with health systems priorities. And you might quibble with that particular figure. I did not, that's not a result of a study of mine, but by the sources cited at the bottom of this slide. But I, just from my limited perspective, I am not surprised to hear that a significant amount of research is ultimately wasted or not well used. Similarly, even when evidence is established, only about 1/3 of studies are implemented. And so what this creates, as all researchers on this call will probably be familiar with, is a great deal of time and energy and money and blood, sweat, and tears spent carefully, conducting and engaging in work that ultimately never sees the light of day and is not made actionable. And so this is, a problem. And again, this is sort of a gap maybe here that rapid qualitative analysis can step into to address a bit, because rapid qualitative analysis is perhaps one way to develop contextually relevant interventions to time-sensitive problems, and also in the process reduce research waste. So that's the lead-in that I want you all, or the frame that I want you all to consider as we move into more of the practical definition and how-tos. So what is rapid qualitative analysis? Well, I'm glad you asked. Broadly speaking, it's an applied method used to obtain those actionable and targeted qualitative data on a shorter timeline, particularly shorter relative to traditional qualitative methods. But I want to caution you here that rapid should not be synonymous in your minds with rushed. Please do not think of it as rushed or haphazard. I am quite sensitive to accusations, historical accusations really against qualitative research methods as being unscientific or having, lacking rigor. This has been something that has been sometimes thrown at qualitative methods, particularly, almost exclusively by people who don't know really the ins and outs of them. And that's always rankled me. I think that qualitative research is in fact quite systematic and quite rigorous and quite scientific and principled. And rapid analysis is no different. So I'd like you to think of rapid qualitative analysis as being pragmatic, as I'll show shortly. It follows accepted scientific practices and is rigorous, and it facilitates the collection of, again, readily applied qualitative data. So it is not haphazard, it is not rushed, and you should apply the same level of thoughtfulness that you would in the case of traditional qualitative methods. That said, compared with traditional qualitative methods, rapid analysis doesn't seek to provide a theoretically rich or very deep or in-depth understanding of a concept or phenomenon. The goals and aims of rapid analysis are different. And those tend to focus on identifying or broadening the understanding of key mechanisms and intervention elements, descriptors or facilitators or barriers of a program in order to address those time-sensitive research questions. So again, the aims are different. And you can see here, hopefully this makes it a little easier to comprehend, this comparison of some key aspects of rapid qualitative analysis relative to traditional qualitative analysis. And I want to give credit, certainly where credit is due. This table was adapted from a great presentation put on by my colleagues in the Denver-Seattle COIN on the Seattle side, Jessica Young and Ashley Mogg, who developed this as part of a larger talk, but titled Two Rapid Analysis Approaches, Template and Matrix Analyses. So as you can see here, though, while traditional qualitative analysis is typically friendlier to more exploratory and inductive inquiries, rapid tends to be more explanatory or deductive. And I'll flesh all of these out a little bit when we do the kind of step-by-step how-to. But it's rapid is not well situated to go into when you're not sure what you're looking for, and don't have specific a priori codes and ideas about what you need for your deliverable. Traditional qualitative analysis is also typically much more descriptive, broader, heavy on the interpretation. Rapid qualitative analysis has a more specific targeted focus. Traditional qualitative analysis is almost always focused on line by line coding and typically engages these days in particular with qualitative analytics software to engage in that line by line coding and then the management and organization of those data. Whereas rapid qualitative analysis typically focuses on or sort of condenses the data into summary tables and or matrices in order to more easily compare and organize the data. And that kind of approach typically relies just fine on Microsoft Word or Excel to do that. And of course, traditional qualitative analysis, as I've already mentioned many times, typically involves more time, both in terms of the data collection and in terms of the analysis. Rapid has, as you would expect from the name, a quicker time frame, but with the caveat that you may need to, if you're engaging in this, you still may need to return to the data or wish to return to the data and expand it later. It's not necessary, you may find yourself wanting to have more detail after your initial product or deliverable has been completed. And in that case, it goes back, it involves going back and, doing it over, essentially, just with a deeper line by line coding approach. But the, regardless, this kind of rapid qualitative approach is particularly well suited to health services researchers. Again, there's pros and cons, which I'll talk about later. But the health services research world is, researchers working in this field typically lead projects that are of importance to the healthcare system. They typically are familiar with key stakeholders like providers and other staff and patients and policymakers, directors, administrators, and so on. And they are able typically to incorporate stakeholder viewpoints to ensure the relevance of research in this dynamic healthcare environment that often has rapidly changing policies. And so because of the particular relevance within the healthcare world, rapid qualitative analysis, I think, is very well suited to plug in here. It might be this way to shorten the traditional research timeline by quickly identifying and addressing real world challenges in a healthcare system. And certainly, as we know in these days, what could be more important? I'm going to describe here a 4-step process for how to do rapid qualitative analysis. And this process, this I'm going to describe, utilizes both a templated summary table and a matrix, which displays a further condensed version of the data. The summary table allows for more detail, it takes a little bit more time, but it enables the identification of differences across participant types. Whereas the matrix is good for high-level, relatively limited number of domains. It's quicker, but it flattens individual participant types. And so some researchers choose under certain circumstances to utilize one or the other of these, only focusing on a summary table or only focusing on a matrix, and understandable under certain circumstances. But I'm going to describe a process that utilizes both because I think that is closer to best practices in most situations. So the first step is to develop a templated summary table, right, to make the bones of it. And what you're going to do with this table is to ultimately, you're going to be populating it with data extracted from transcripts, including illustrative quotes. So sometimes these tables take different shapes. Sometimes people organize these domains, pre-specified domains by column and sometimes by row. But regardless, what you want to do is break up, kind of identify before you populate the table some of these domains that you think are going to be relevant for analysis. So you can think of them like a priori codes. They are typically based quite closely on the data collection guides, like the interview or focus group guide that you've used, and or any kind of questions or issues that you and or people in the literature have identified as critical, including, by the way, your stakeholders. Your stakeholders might have given you some instructions that they're particularly interested in X or Y. You should consider how to incorporate those into domains. And another, set of issues that you may think to map your domains according to would be not just the guides themselves, but also any frameworks that you might have used. As I'll talk about in a, sort of throughout this, the frameworks, or rather rapid qualitative analysis is very friendly to the use of templates, such as the, well, a variety of kind of things like the CIFAR and things that have already existing domains or themes throughout the frameworks. You can easily borrow some of those to populate your domains. It's also good practice to include an other category in addition to some pre-identifying domains in order to capture data easily that seem important, but don't readily or obviously fit into those domains. And then the second column, or sometimes row, in this table will summarize key points from the data and capture illustrative quotes. I'm going to show you an example of this to concretize this in a minute, but just so you know, it's always good practice to have the entire team, the entire research team, review a draft summary table before you populate it, and then to have the entire analytic team test it with a single transcript and then modify it if that's needed. It's also helpful to identify the corresponding questions from the guide that may prompt participants to address the specified domain. So let me give you an example here to, as I said, concretize it. So this example is from an excellent resource by Gail and colleagues from a few years ago that illustrates how they put together their summary table. You can see here, these are domains that they identified as being worthwhile to focus their data collection around or their analysis around. And they've also indicated here, you can see these numbers, these are the relevant interview guide questions to automatically trigger the analysts or analytic team to look for. In other words, it's likely in this case that respondents would have given information about their, for instance, awareness in question 3. And then this group used the CIFAR, framework that I mentioned before, and these are domains that they've identified to kind of mapped onto the CIFAR framework. Another example is from my own work, which is ongoing. We've not yet published on this, but I'm a member of the WELDUM task force, and that is a group here at CU in the Department of Medicine charged with identifying distress and burnout among faculty here over the first 18 months of the COVID pandemic. And I use this simply as an example, as a contrast for a table. You can see how in this case, we identified just a handful of domains as being relevant that we wanted to focus on. We wanted to, of course, we conducted focus groups here, and this table identifies the role, the experience of the pandemic experience, the impact of COVID on researchers' well-being, stress and burnout specifically, and then recommended solutions that they identified, as well as this other category. And then we have illustrative quotes down here at the bottom. So you can arrange this table as needed, but the operating principle here is that you have space for your pre-identified domains and illustrative quotes. Now, once you have the table populated, the table constructed in the way that feels intuitive to you, then you want to populate it with summary tables. And you want to generate one summary for each transcript. So you're going to use this table once for each transcript. So if you have 20 transcripts, you're going to have 20 tables initially. You want to populate these short, understandable bullets with one data point per bullet. You want to, again, closely tie it to the data. This is not intended to be interpretive. You're just supposed to be paraphrasing and summarizing. And it shouldn't take you more than an hour to summarize a hour or fewer length transcript. You also want to be careful to standardize the detail, the level of detail across the team. It's, again, as I've mentioned, it's good practice for all the team members to summarize one transcript, the same transcript first, to kind of test drive your summary table template and then review the process together. And if you're working as a team, the qualitative lead should then conduct a secondary review of the summaries to check for overall consistency and quality. And if there's any problems, if there are inconsistencies, that qualitative lead should discuss that with the analysts, and it may require them to go back and make some revisions to ensure consistency across level of detail. Then you want to create a matrix. And the idea here is that you want to consolidate all of these tables that you have. The matrix is particularly helpful here too, because you can organize it by participant type, or whatever other relevant variable may come up, but the participant type is often the most useful. And this helps you with easier visual display and comprehension of the basic patterns. It'll help you identify the commonly occurring themes and allows comparisons across those groups. As I've mentioned before, creating the matrix in Excel is perfectly sufficient. And I'd recommend having one tab per participant group or relevant variable. And you want to set up your matrix to capture several pieces of data, both the broad themes or categories, and then relevant sub-themes or descriptors. You know, for instance, what participants might have reported within that theme as working well, or what they saw as not working well. And then the illustrative quotes that will provide evidence to support these points. And as always, an example I think here is helpful. You can see here again from the Gale and colleagues publication, you can see here they have a couple of themes listed here. Theme of training, right? So the sub-theme here, what worked well? The exemplar quotes, and then opportunities for improvement, which is another way of saying, in this case, what didn't work well, and then exemplar quotes here. And same thing with this theme, and then these sub-themes. And then you can see down here, they have different tabs by their two participant groups, academic detailers and providers. So I hope that makes sense. And again, you can switch the order of the columns and rows to work best with your preferred kind of visual orientation. But I hope this is clear that you're essentially consolidating all of the individual summary tables that you have into themes, sub-themes, and then with exemplar quotes. So, you know, you're populating these tables, as I've already mentioned, with the individual transcript summaries. And the goal is then to refine that initial list of themes and sub-themes and to highlight those salient quotes. Broad themes need not be limited to a certain number of sub-themes, although in my experience, it's typically always about 2 to 5 sub-themes that emerge from the broader themes. I'm going to pause here and look at time. Okay, I see that time is already getting short. So I'm happy to talk more about those steps in the Q&A, but I want to emphasize here that you really do need to think about when to use rapid qualitative analysis and when not to. You know, in other words, what are the limitations? Rapid analyses are particularly well suited for situations when you need to quickly produce information, such as when you're informing ongoing implementation or you want to comply with a policy mandate. It's helpful to be able to give or identify key actionable suggestions to stakeholders in something much closer to real time. And that also includes giving feedback to teams as the project continues, as in the case of essentially a developmental evaluation. Rapid analysis is also very well suited, of course, when the data are text-based, either written or originally verbal, and then turned into transcripts, written transcripts. Examples of this are interviews, focus groups, or notes or chats from meetings. And it's also helpful when data are not overly complex, and that you don't have to be analyzing them within an interpretive, narrative-based lens. You wouldn't use this approach in most cases to analyze somebody's salient events of their life history. That's much too interpretive and narrative-based, and not as targeted or specific as would be helpful here. Rapid analysis is also very appropriate when you need to develop other products or other aspects on the same project. So for instance, when you might need data for preliminary studies, like a study section for a proposal, or for abstracts or conference presentations, when you need to inform quantitative instruments or understand unexpected findings or get feedback from content experts. They lend themselves, rapid analyses lend themselves very well to some of these common methodological combinations that we often see across or between qualitative and quantitative data. So typically quantitative data are used to study outcomes and qualitative data to study processes. Rapid analysis can be used to plug in key aspects of processes and identify key aspects of processes that then can be married or paired to the quantitative outcomes in a quicker way. Similarly, to understand context that's relevant, that can be plugged into quantitative measures of content. And qualitative data is, as we know, sometimes used to explore a phenomenon and generate a conceptual model and hypotheses, paired then with quantitative data to test hypotheses. In this case, you could use rapid qualitative analysis, not in exactly the same kind of exploratory way, but to hone in on particular targeted aspects of a conceptual model that may or may not be relevant to stakeholders. Data collection, rapid qualitative data collection targets and processes that are highly structured are also very appropriate for rapid qualitative analysis. By targets, I mean things like deliverables, selection of interviewees, interview or focus group protocols, and by structured processes, I mean, as I've already alluded to, when processes are informed by frameworks like the Consolidated Framework for Implementation Research, the CFR. And also when stakeholders are clearly identifiable and accessible, that makes it much more direct and easy and identifiable. It's also, rapid analyses are also appropriate when you're clear, maybe this is the biggest one actually, when you're clear about your goals and your deliverables, and also when you're faced with resource constraints. As we've already discussed, in-depth analysis can be resource intensive. Line by line coding and analysis might not always be possible, particularly when you have a large N, at least relative to qualitative work. And when you're working with a restricted timeline, time being perhaps the biggest resource constraint of all, but also when your funding is maybe less for a year, or you have deliverables that are due on a particular day that's coming up sooner than would allow for longer, more in-depth line by line coding. So there are lots of benefits to rapid qualitative analysis. It reduces time. It reduces cost in most cases. It typically increases the amount of collected data and improves the efficiency and often improves the accuracy of the data that you are collecting and presenting. And it also adheres to our understanding of good, so-called good qualitative research. Cohen and Crabtree have identified a series of aspects that make for good qualitative research, including carrying out ethical research, the importance of the research, clarity and coherence of the research report, the use of appropriate and rigorous methods. Now, my last couple of minutes here, though, so I want to just emphasize a couple of things to keep in mind. Rapid analysis typically stays at the level of a higher level of data. And that may make it more challenging to determine the relative strength of a construct. And it also may miss, in fact, almost certainly will miss some of the deep detail involved with line-by-line coding. It can also limit the ability to compare findings across projects unless findings are mapped to the same framework that would provide a consistent taxonomy. And that's something to be quite thoughtful about. It also, the compressed timeline with rapid analysis can result in a heavy workload in a smaller period and sometimes a logistical burden. Although several researchers have found in comparison that the burden for training is generally limited to learning how to use and populate the templates and the matrices, while line-by-line coding typically takes much more time in terms of how to use it, learning how to use it and create a code book and how to use qualitative data analytics software. And we also need to be cognizant of the fact that using rapid analysis has the potential to provide a narrower interpretation of data, and therefore it may not be as appropriate for projects in which summarizing themes or concepts requires that subjective interpretation of the data that goes beyond a more structured approach. My last point here will be that many people wonder whether publishing with rapid qualitative analysis is possible. And the answer is yes, it sure is. And it's becoming more and more acceptable to do so. Alison Hamilton has several great resources about rapid analysis. And her most recent one that I'm aware of was from 2020. You can access it at this link. And she covers some of this in some detail. And it's also worthwhile to note that some researchers may choose to conduct traditional analysis following rapid analysis after the initial deliverable is completed. Again, Gail and colleagues did this and found actually that their rapid and traditional analysis resulted in similar best practices. But the traditional analysis took 69 days longer, which, you know, that's pretty considerable. But as with everything, the key is to clarity about how to describe your methods and which examples to cite. I've included a few here drawn from Alison Hamilton's examples as well that you might want to look at to see how they did it and to cite. But remember, as with everything in life, or almost everything in life, fit is everything. Not only a fit between your work and the funding agency or partner or mechanism that you're working with, but also, and certainly in this case, relevant to this case, between your research purpose and the analytic approach that you choose. Then you just need to demonstrate that fit by translating it effectively to your audience. There are a series of excellent resources here that I hope you will draw on as you are interested. And I, of course, am always available to answer any questions, especially because we're getting a little short on time, I know. But I would love to answer any questions I can, both now and via email, if you want to reach out to me at one of these email addresses. So I'll close now, and thank you so much for sitting through this talk, and I look forward to answering at least a few questions.
Thank you so much, Karen. That was fantastic. And there's a number of comments in the chat here about how great this was. And we will post the slides and the recording on our Chords Education archives if you want to grab all those great references and resources you just shared. We do have a bunch of questions, and so maybe we can rapidly ask and answer the questions. So yes or no, can rapid qualitative analysis be conducted on a shoestring budget with a one-person team and maybe a volunteer secondary person reviewing the tables? Would you recommend that one-person team?
Well, yes or no and recommend is like those are sort of two different questions.
I guess so, yes.
But if forced into a yes or no question, answer, I would say yes. Yes, it can be. And you know, would I recommend it as a best practice? No, but you know, sometimes things can't be perfect all of the time, right? I mean, I am all for best practices that can enable more rigor and reliability and so on. But if you have a shoestring budget, you have a shoestring budget, and I would be transparent about that in your write-up. You know, that it was a one-person analytic team, quote unquote, and discuss the limitations of that. But I would still encourage you to do it.
And is this a method that you would suggest for students to learn for maybe in their capstone experiences, or do you think that really you should just start with the traditional approach for a novice qualitative researcher?
Interesting. I absolutely advocate students learning this approach. I feel very strongly that this or variants thereof will be the likely way of the future, at least in the health services research world. And for right or wrong, honestly, there's pros and cons to that. But I think that given the rapidly shifting environment that we live and work in now, that there will be more encouragement and need to get results out more quickly. So I absolutely advocate students learning this. Where the question really for me would be whether, which comes first. It might be an effective pedagogical approach to have students learn both at the same time, so that they're not, they can have an in-depth kind of understanding of the constraints and opportunities involved with both, and they're not predisposed to think that one is the standard. So I guess that's up to each individual instructor, but I would certainly encourage students to learn it.
Fantastic. I'm going to pick and choose a little bit here. So one person asks, how do you suggest doing the thematic part of the analysis as you create the matrix? And how is that different from traditional qualitative thematic analysis, if at all?
Yeah, so the population of the summary table by or with domains is really the key to this. Identifying those domains that you're going to be using to target your analysis. And those the differences, I would encourage you to think back to that comparison table of traditional qualitative approaches and rapid qualitative approaches. The main difference there is that you can think of domains in the rapid approach as essentially as deductive a priori codes. Typically in traditional qualitative analysis, I advocate for the use of both emergent codes, sometimes called in vivo codes, and then deductive a priori codes as well. But with rapid approaches, the focus is on a priori deductive ones. And so a very reductionistic way of thinking about this is to, if you're using a framework, then go through and identify the key domains identified in that framework and use those to map onto your domains. And then alternatively, or in addition, to look at your interview or focus group guides and look at those questions, right? You've constructed those questions for a reason based on something. And so map your domains onto the nuggets, the core substantive chunks of those of each of your interview questions, or in some cases, a pair or two or three of those questions that all get at the same thing.
So we are unfortunately out of time for today, and we have so many questions left here. I think what we'll do is download all of these questions, and maybe Dr. Albright would be willing to provide short written answers that we can send around to everyone afterwards, if that's okay.
Absolutely. Yeah, I'm happy to do that. And yeah, I welcome conversation about this. And I want to emphasize here too, there are so many people, or an increasing number of people who have developed expertise in this, including some of the people cited in my excellent resources section in the Seattle COIN that I mentioned, Jessica Young and Ashley Mogg. And the VA in particular has led with excellent examples of rapid qualitative analysis. So I'm happy to direct you to some of those people and resources and projects as well. But I welcome contact from you and appreciate your interest in this. And thank you, Bethany and Accords, for inviting me to be part of this. As I said, it seems like not surprisingly, it seems like you have a very thoughtful series laid out, and it's a pleasure to be part of it.
Well, of course, and I just want to point out that this whole series has been planned in coordination with the Accord's Qualitative and Mixed Methods Research Core. We have a lot of methodologists here within Accords that are available to support this process. You do not need to be on your own, especially if you're local here. And so thank you again, everyone, for attending, and Dr. Albright for your presentation. We'll be sending around answers to the questions as well as a post-talk evaluation within the next couple of days. And you can look for the slides and the recording up on our website shortly as well. And if you haven't yet, please register for CopperCon. There will be lots more research methods to learn there. Thank you, everybody.